Yeah, so I was first hospitalized at 6 months old, and they discovered that I did have chronic intestinal pseudo-obstruction, likely known as CIPO. This is where the intestinal muscles don't fully relax and move things through the digestive system. So throughout my life, I just had a hard time, getting all the nutrients that I needed, which led me to having my first feeding tube at 2 years old. And then I've just constantly been in and out of the hospital, trying to get my intestines to work, giving bowel rests, taking different medications to get it moving. Um, there's no cure for SIPO, and so it was really just like, what's the best way to manage the symptoms? Which eventually led to me having gastroparesis from my intestines not working. It slowly moved into my stomach, and so that was fun. Gastroparesis is just your stomach just can't empty regularly. It empties slowly, and so a lot of people have a hard time, still obtaining those nutrients. Sometimes, being nauseous, not being able to eat a lot, things like that. Um, and then when I was 16, I actually had my ostomy surgery. So I am a huge advocate for ending stigmas around ostomy bags and bringing awareness to that as well. And so after my ostomy bag, I still had issues with my SIPO and just, navigating my intestines that weren't working. They were, really stretched out from not being able to move and whatnot. So was about 7 years ago that they did a total colectomy and removed most of my intestine besides 20 centimeters, which left me with short bowel syndrome. Since then, I haven't really been in and out of the hospital as much, which has been super beneficial, but I am dependent on a feeding tube on TPN 10 hours a day. And so we all know the risk factors of TPN ruining your liver, potentially losing access for your veins and stuff with that. So, they have talked about an intestinal transplant through Nebraska Medical. And so we are looking into that as things may decrease in my health.
That's an awful lot. Um, and from such a tiny age as well that you've been living and combating the symptoms. You said everybody knows what a TPN is, but I don't think everybody does. So can you take us back to basics and just describe exactly what that means?
Yeah, so TPN is called total parental nutrition. It's just a feeding tube that goes in your arm or in your chest, that goes into your heart. And then you do IV medication that gives you all your nutrients once a day. Most people are on it sometimes for 24 hours a day, 12 hours. I'm on it for 10. Just kind of depends on how your body can process it. But yeah, it gives me all my nutrition, fluids, everything like that. So that is literally my life source right there.
And the whole process of eating, that for many people is just a normal everyday activity that you don't even think about when you just pick something up, put it in your mouth, you chew it, and it works its way through its body. For you, do you, what would that have been like? What would you have had to consider before you started to enjoy a meal with your friends or your family?
Yeah, food was always a hard thing growing up, especially in school. Um, everybody's sitting at the lunch table, and you either bring your lunch from home or you grab lunch, and then they make you choose all the food groups, and you get milk. And I didn't do really well with dairy or vegetables, things like that. I didn't do well with breads. There wasn't a lot of foods that really were beneficial for me to eat other than really a clear or soft liquid diet. That was probably the most beneficial for my intestines. But I mean, there's the part of you that also is hungry constantly because you're not getting the nutrition that you need, the proper nutrition. So you're I'm starving, but also if I eat this, I know I'm going to be sick or throwing up later, or in pain. And so it was picking my battles for sure, especially as a child. do I want to eat that? Do I want to like have the consequences later? Or am I good? There were a lot of times that I chose to just fit in with the crowd and, partake of whatever was happening, whether it was at a birthday party or a family function. But I definitely sometimes paid for it later. But you gotta live life and sometimes consequences happen.